semi-fluid contents of the stomach. Irregularly intervals, gastric peristalsis passes the spine through the pyloric canal and pyloric orifice into the small intestine for further mixing, digestion, and absorption. The interior of the stomach is described as smooth surface of gastric mucous layers of the stomach, reddish brown during light except in the pyloric part where it is pink. When contracted, gastric mucus is thrown into longitudinal ridges, which are called gastric folds or rugae. Take a look in your atlas, all the parts which are marked towards the pyloric part along the greater curvature, gastric canal furrows, which are formed temporarily during swallowing between longitudinal gastric folds of the mucosa along the lesser curvature. It can be observed radiographically and endoscopically. Gastric canal forms because of the firm attachment of the gastric mucus to the muscular layer, which does not have an oblique layer of this type. Saliva and small quantities of masticated food and other fluids also pass through gastric canal to the pyloric canal. Take a look in your atlas how the stomach is related with all these parts. Because the stomach is covered by peritoneum, with exception of the blood vessels which runs along its curvatures, and in a small area posterior to the cardiac orifice. Two layers of the lesser omentum extend around the stomach and leave its greater curvature as the greater omentum. Take a look at this part in your atlas, right? And it's mentioning that anteriorly the stomach is related to the diaphragm, the left lobe of liver, and the anterior abdominal wall. And posteriorly, the stomach is along to the omental bursae and the pancreas, and where the posterior surface of the stomach becomes or forms most of the anterior wall of the omental bursae. And the bed of the stomach, right, which is where the stomach rests, in the supine position is formed the structures forming the posterior wall of the omental bursae, right? And then when we take a look from superior to inferior, right, the stomach bed is formed in the following way. Left dome of the diaphragm, the spleen, the left kidney and suprarenal gland, and the splenic artery, and the pancreas, and the vermis of colon and colon are clearly visible. Therefore, the vessels and the nerves of the stomach. The stomach has a rich arterial supply. Gastric arteries arise from the celiac trunk and its branches. The left gastric artery arises straight from the celiac trunk and runs in the lesser omentum to the cardia and then turns to course along the lesser curvature of the stomach and anastomose with the right epigastric artery. The right gastric artery arises commonly from the hepatic artery and goes to the left along the lesser curvature to anastomose with the left gastric artery. The right gastro-omental artery, which is called also the gastroepiploic artery, arises as one of two terminal branches of the gastroduodenal artery, going to the left along the greater curvature and anastomosing with the left gastro-omental artery. The left gastro-omental artery arises from the splenic artery and courses along the greater curvature and goes to become anastomosed with the right gastro-omental artery. The short gastric arteries, which are 4 to 5, arise from the distal end of the splenic artery or its splenic branches and pass to the fundus of the stomach. The gastric veins parallel the arteries in position and course. The left and right gastric veins drain into the portal vein, and the short gastric veins and left gastro-omental veins drain towards the splenic or into the splenic vein, joining the superior mesenteric vein, forming the portal vein. The right gastro-omental vein empties at the S capital M capital V capital. A prepyloric vein ascends over the pylorus to the right gastric vein. Obvious, this vein, right, in living people, right, they usually, all the doctors look for this vein to identify the pylorus. Right. Take a look at all these descriptions in your atlas, right? Take a look in your atlas, right? The bed of the stomach, right? Most of the lesser omental, right, in the dissected part, right, and where you can see the peritoneum and the posterior wall, right, of the omental bursa, which is covering the stomach bed. The gastric lymphatic vessels, which go along the arteries with the greater and lesser curvatures of the stomach. They drain lymph from its anterior and posterior surface over its curvatures, where the gastric and gastro-omental lymph nodes are located. The efferent vessels from these nodes accompany the large arteries to the celiac lymph nodes. The summary of lymphatic drainage of the stomach, it looks like this. The lymph from the superior 2/3 of the stomach drains along right and left gastric vessels to the gastric node. Lymph from the fundus and superior part of the body of the stomach also drains along the short gastric arteries and left gastro-omental vessels to the pancreaticosplenic nodes. And where the lymph from the right 2/3 of the inferior third of the stomach drains along the right gastro-omental vessels to the pyloric node. Also, where the lymph from the left 1/3 of the greater curvature drains towards the end by and with along the short gastric and splenic vessels to the pancreaticoduodenal nodes. The parasympathetic nerve supply of the stomach from the anterior and posterior vagal trunks and their branches, entering the abdomen through the esophageal hiatus. Anterior vagal trunk, which derives from left vagus nerve C, capital N, capital N, X, Roman letter. Usually enters the abdomen as a single branch that lies on the anterior surface of the esophagus, running towards lesser curvature of the stomach, where it gives off hepatic and duodenal branches, leaving the stomach in the hepatoduodenal ligament. The rest of the anterior vagal trunk continues along the lesser curvature, giving rise to anterior gastric branches. The larger posterior vagal trunk derives mainly from the right vagus nerve, enters the abdomen on the posterior surface of the esophagus, and passes towards the lesser curvature of the stomach. The posterior vagal trunk supplies branches to the anterior and posterior surfaces of the stomach, providing it gives off a celiac branch running to the celiac plexus and continuing along the lesser curvature, giving rise to posterior gastric branches. The sympathetic nerve supply of the stomach from T6 to T9 segments of the spinal cord goes to the celiac plexus through the greater splenic nerve and is distributed through plexuses around the gastric and gastromental arteries. Take a look in your atlas, all these descriptions along with the nerves and arteries. Take a look at the tables, right? There are around there, right? And all the descriptions that there are of the nerve supply, the organ, the spinal cord where it's located, and reference site, right? And you find the clinical examples, right? The artery, the origins, the course, and distribution, right? Take a look at all these tables, which are very interesting, right? And take a look at all the figures related with the lymphatic drains, innervation of the stomach and small intestines, right? Along with all the descriptions. The small intestine consists of duodenum, jejunum, and ileum, and extends from the pylorus in the ileocecal junction, where the ileum joins the first part of the large intestine. The pylorus empties the contents of the stomach into the duodenum, the first of the three parts of the small intestine. Right. We're going to mention, right? The duodenum. The duodenum, the first and short part of the small intestine, is the widest and most thick part. Pursues or is a C-shaped course around the head of the pancreas. Begins at the pylorus on the right side, ending at the duodenum-jejunal junction on the left side, where this junction is approximately at the level of the L2 vertebrae, 2 to 3 centimeters to the left of the midline. The junction usually takes the form of an acute angle duodenojejunal flexure. Most the duodenum is fixed by peritoneum to structures on the posterior abdominal wall and is considered partially retroperitoneal. and is divisible into four parts. The superior first part is short, 5 centimeters, and lies anterolateral to the body of L1 vertebrate. The descending second part is longer, 7 to 10 centimeters, descends along the right side of L1 through L3 vertebrae. The horizontal third part is 6 to 8 centimeters long and crosses L3 vertebrae. Ascending fourth part is 5 centimeters and begins at the left of L3 vertebra and raises superiorly the superior border of L2 vertebrae. The first 2 centimeters of the superior part, the first part of the duodenum, right away distal to the pylorus, has a mesentery and is mobile. This free part is the ampulla, which is called the duodenal cup, which has the appearance from the remainder of the duodenum when observed radiographically using contrast medium. The distal 3 centimeters of the superior part and the other 3 parts of the duodenum have no mesentery and are immobile because they are retroperitoneal. The relationship principally of the duodenum are can be found right also along in the atlas, right, and on tables that are on the just right size all these expressions, right, and but it still mentions, right, the superior part, right, is the first part of the duodenum, which ascends from the pylorus and is overlapped by the liver and gallbladder, where peritoneum covers its anterior aspect, but it is bare of peritoneum posteriorly, except for the ampulla, the 2 centimeters first that joins the pylorus. The proximal part has the hepatoduodenal ligament, part of the lesser omentum, which is superiorly, and the greater omentum attached inferiorly. Posterior to the superior part are the portal vein, bile duct, gastroduodenal artery, and I, capital V, capital C. The descending second part of the duodenum runs inferiorly, curving around the head of the pancreas, lies to the right and parallel to the IVC. The bile and pancreatic ducts enters its posteromedial wall. These ducts usually unite the form to become the hepatopancreatic ampulla, opening on the summit of an eminence located posteromedially in the descending duodenum, the major duodenal papilla. The descending part of the duodenum is retroperitoneal, entirely anteriorly surface of its proximal and distal third is covered with peritoneum.